This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
We're working to connect a region of over 600 cultural bridges between our lands.
Hello, you're watching ASEAN in Focus. We're coming to you live from Manila and Thailand. Hello, Faye.
Hello, this is Faye Barte, live here in Thailand, bringing you the latest news in the dynamic Asean region.
On today's headlines. A lawyer representing Aung San Suu Kyi said the ousted civilian leader has been hit with a new criminal charge.
Governing sea assets will be continuously deployed to different areas of the West Philippine Sea, or WPS, for maritime sovereignty patrol and other law enforcement activities. The Area Task Force, or ATF, west of the National Task Force for the West Philippine Sea, said on Tuesday.
The following day, you want me to...
President Duterte on Monday night said the Philippines would have turned into a narco-politic state had he not launched his administration's aggressive crackdown on illegal drugs.
Bangko Sentral ng Pilipinas, or BSP, Governor Benjamin Jokno said the country's inflation rate remains under control despite surpassing the government's target band since January this year. He said the slower inflation rate last March was due to several factors like deceleration of the rice and vegetable inflation.
First, to the ongoing crisis in Myanmar, a lawyer representing Aung San Suu Kyi said the ousted civilian leader has been hit with a new criminal charge. Kin Maung Zaw added that Suu Kyi appeared along with President U Win Myint and Chairman of the Naypyidaw Council, Dr. Myo Ang, by video link during a hearing in Naypyidaw. Take a listen.
Aung San Suu Kyi was charged further with one more offense. That is the same law and under the same law and under the same section. Natural Disasters Management Law, Section 25. But this is the new case. And the plaintiff of the case is U Nyi, alias U Tomiao. Whether he is an official of a ministry or he is a civilian, well, we cannot know for sure. All three of them were, as they were charged in one case, they all three of them were co-accused. They appeared on the video conferencing all together.
Ms. Suu Kyi appeared for Monday's court hearing via video link and was slapped with an additional charge related to a natural disaster law, according to her lawyer. Min Min So said Suu Kyi, who is under house arrest in Naypyidaw, appeared in good health, but it isn't clear if she has any idea of the turmoil that has unfolded in Myanmar over the past 2 months. The most serious charge Suu Kyi faces falls under Myanmar's official secrets law. She's charged for illegally importing walkie-talkies, flouting coronavirus restrictions, spreading information that fanned social unease, and receiving $600,000 and gold from the then chief minister of the Yangon region.
In a statement read by a UN spokesperson, the Secretary General reiterated his deep concern about the developments in Myanmar, adding that the most recent reports in violence and killings by security forces are appalling. Here's UN spokesperson Stefan Dujarric. Let's take a look.
Turning to Myanmar, I can tell you that the Secretary General reiterates his deep concern about the developments in that country. The most recent reports of violence and killings by security forces are appalling. The Security Council has clearly called for a stop to the violence and invited the parties to pursue dialogue and reconciliation. The Secretary General encourages all member states to use their influence to impress on the parties the need to stop this escalation and to take steps that will facilitate the return to civilian rule. He emphasizes that the key role that the region can and must play in advising the national actors to take steps towards the return of peace and stability in Myanmar. The United Nations Special Envoy Christina Schreiner Bergener is currently in the region, where she is meeting with key interlocutors in order to promote an effective international response based on a unified regional effort. She remains ready to visit Myanmar at the earliest opportunity. From Myanmar, our colleagues there said they are appalled by the violence since February, in which some 93 protesters were reportedly killed, many of them in the city of Bago. The UN team there says, the UN team in Myanmar says it is particularly concerned over reports of the use of heavy artillery against protesters. The UN Human Rights Office says that as of today, credible reports show at least 707 people having been killed since the military seized control of the government more than 2 months ago. It is believed this may be significantly higher. Since February 1st, thousands of people have been injured, and many of them seriously.
The country has been rocked by daily protests since the military seized power on February 1, and the authorities have launched a bloody crackdown on dissent, with hundreds killed and more than 2,500 arrested. State media reported Friday that 19 people had been sentenced to death for robbery and murder by a military court, with 17 of them tried in absentia. They were arrested in Yangon's North Okalapa Township, one of 6 areas in the commercial hub currently under martial law, meaning anybody arrested there is tried by a military tribunal. The 6 townships are home to about 2 million people, more than a quarter of Yangon's sprawling population. While Myanmar has long had a death penalty in its penal code, the country has not carried out an execution in over 30 years, said Phil Robertson, Deputy Director of the Asia Division for Human Rights Watch. He added trying cases in a military court means there can be no appeals, and there are no guarantees of a free and fair trial in any way, shape, or form. The sentences could be a tactic to force protesters off the streets and back to work, he said, as the nationwide boycott has brought much of Myanmar's economy to a halt.
In other news, government sea assets will be continuously deployed to different areas of the West Philippine Sea for maritime sovereignty patrols and other law enforcement activities. This is according to the Area Task Force west of the National Task Force for the West Philippine Sea on Tuesday. In a statement, the body said this is part of its efforts in addressing the recent developments in the WPS through a more extensive and collaborative effort among its member agencies. It added that the Philippine Coast Guard, or PCG, has deployed BRP Cabra MRRV 4409, while the Bureau of Fisheries and Aquatic Resources, or BFAR, has sent 2 more ships in the area. Meantime, the Armed Forces of the Philippines, or AFP, through the Western Command, has deployed 4 Philippine Navy vessels, namely BRP Dagupan City, BRP Apolinario Mabini, BRP Magad Salamat, and BRP Miguel Malvar. These ships will provide support and assistance to PCG and BFAR vessels in the area. The ATF West also urged all Palawan residents and all Filipinos to know and understand their role and to take their part in the nation's stake in the West Philippine Sea. It added that through a whole-of-nation approach on the issue, the country's interests and security will be safeguarded for the present and future generation of Filipinos.
Now, in other news, 10 members of the Abu Sayyaf Group, or ASG, have peacefully surrendered to government authorities in the province of Sulu, and military officials announced this on Monday. Major General William Gonzalez, 11th Infantry Division commander, said They surrendered Saturday afternoon to the headquarters of the 1101st Infantry Brigade headed by Brigade General Antonio Bautista in Barangay Samak, Talipao, Sulu. Bautista, who facilitated their surrender, said the 10 ASG surrenderers are from the municipality of Indanan, except Gani, who is from Patikul. Bautista said they turned over an M16 Armalite rifle, one M1 Garand rifle, a caliber 30 carbine, and two 45 caliber pistols. Bautista presented them to Gonzales in a ceremony for their formal local integration held at the 1101st Infantry Brigade headquarters. He said they decided to surrender to be reunited with their families and to start a new life. Salim, 20 years old, and Jumli, 21 years old, who are siblings, revealed they joined the ASG sometime in 2016 when they were still teenagers upon invitation of a friend, according to Gonzales. Gonzales said that the two were just able to reach third grade as they have lost interest in education, especially after their father left for Sabah. He said that with pressure from their peers and promise of instant cash, they ventured to go in and out of the hinterlands of Sulu. The friend who recruited them has died with Mohammed said during a clash with government forces in 2016.
In Malaysia, several foreign missions have advised citizens with expired social visit passes to prepare to leave next week. We have an update from Alfred Balmes from our EBC Malaysia Bureau. Hello, Alfred.
Hello, Alma. A reminder from several foreign missions in Malaysia advising their citizens with expired social visit passes to be prepared to leave by next week has left many scrambling for answers. Mostly of them had been stranded in Malaysia since early last year when the COVID-19 pandemic hit, and they were made to understand that they could stay in Malaysia for up to 14 working days until the end of the movement control order, which has not been lifted until now. The foreigners in the country began receiving emails from their embassies in Malaysia advising them that they may have to leave the country before April 21st if they have a social visit pass that expired on or after January 1st, 2020. The email detailed that there was a 14 working days grace period for them to leave after the end of the MCO on March 31st this year without applying for a special pass or approval from immigration. The MCO was extended until April 14. There has not been any indication from the government that the grace period has been extended. A number of attempts have been made to contact officials from embassies here and the Malaysian Immigration Department on the matter. As a press time, both have yet to issue a statement on the matter. Meanwhile, foreigners who are currently in the country have mixed reaction on the matter. Some felt confused due to lack of an official statement from the Malaysian Immigration Department. Others with expired social visit pass do not want to return because they don't want to face strict lockdowns or high number of COVID-19 cases in their home countries, while others are hoping to be allowed to stay longer. Back to you, Alma.
All right. Thank you very much, Alfred. Hoping to get more updates on this developing story. Thank you very much for your time.
Thank you. Reporting from Kuala Lumpur, Malaysia, this is Alfred Balmes. We live in interesting times.
ASEAN in Focus. We'll be right back. Stay tuned.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Welcome back to the program and more updates in the Philippines. President Rodrigo Duterte on Monday night said the Philippines would have turned into a narco-politics state had he not launched his administration's aggressive crackdown on illegal drugs. President Duterte made this declaration after lambasting detained Senator Laila de Lima for her remark about Senator Christopher Bongo allegedly covering up for him while he was out of the public eye last week and misleading Filipinos on his true capacity to lead. Let's watch this.
The following day, if you want me to die early, you must pray harder. Actually, what you intend or what you would like to happen is to see me go. You want me to go and you're praying for that. Itong isa, nasaan ang presidente? You know, baka patay na. Sabihin ko sana na, nandito lang ako sa Malacanang, natutulog ako, mag-isa. Ikaw, sino ang kasama mo sa kama? Ikaw ba ang may-ari niyan? You know, it takes two to tango. Pag binabastos ninyo ako, babastosin ko rin kayo. Kaya kay Dilima, tama yan sa iyo. Magtiis ka, binastos mo ang Pilipinas ng druga dyan mismo sa National Penitentiary. Ngayon, sige kayaw-yaw dyan kung ano-anong pinagsasabi mo na hindi ko kaya. Bakit? Ikaw ba ang nag-elect sa akin? Did you elect me as president? I got my votes, substantial one, to make me a credible president. Galit ka lang kasi naging presidente ako. Galit ka lang kasi ako may ginawa ako sa bayan. Galit ka lang kasi ako, hindi ako pumayag na itong bayan ko pupunta sa aso. Galit ako kasi ang mga anak natin, hindi ako papayag na magiging narco state tayo.
Benhar Abalos reported that the mayors of Metro Manila have agreed to provide additional COVID beds to accommodate more patients now that more Filipinos are falling ill with the virus and its new variants. Chairman Abalos also mentioned that the 230 million pesos provided by the national government for the emergency hiring of contact tracers will be used for 3 months to further improve our contact tracing efforts. Take a look.
Unang-una po ay talagang sumusuporta ho ang lahat ng alkalde sa naging desisyon po ng IATF at ang ating Pangulo. Alam naman ho natin talagang mahirap po ang panahon ngayon, importante ang pagkakaisa. Makikiisa po lahat ng alkalde kung kaya nag-usap-usap po kaagad pagkatapos sumitin ng IATF nung gabi at napagkasunduan na magiging curfew sa Metro Manila ay alas 8 ng gabi hanggang alas 5 po ng umaga. Bukod dito ay nakausap din namin si Secretary Duque at siya po ay humihingi ng tulong na kung posible na bukod doon sa private ay yung mga ospital na ito po ay pinapatakbo ng mga lokal na pamahalaan ng lungsod ay maglaan ng mga kama pa. No? At hindi lang kama, importante nakafocus talaga sa ICU. Ang mga reports po ay sa Quezon City, kay Mayor Joy, ang Quezon City General Hospital ay 10 kama, ang Bautista Hospital, 10 rin, Novaliches District, 10 rin, ang Hope Community Care, 1,000 beds. No? Ang Taguig, ito ho, for critical care ay 7 kama, ang kanilang inambag. Itong critical care po ay may high flow at mga ventilators. No? And of course, sa quarantine facilities, 43 na kama po ito at 43 rin sa mild. Sa Nabotas, 100 kama. Nag-usap-usap po kami nila sa Duque at andito po mamaya si Secretary Vega, si Yusek Vega. Tutulong po sila sa mga nurses at mga doktor po rito. At bukod po rito sa ay ang Mandaluyong, no? Ang Mandaluyong po ay tinignan namin at nag-commit po kami rito ng ang aming ICU ay mga 8 pwedeng gawing ICU, but for the meantime, gagawin muna namin for critical care. No, lalagyan po ito ng high flow sa tulong po ni Yusek Vega and of course mga nurses. Sa San Juan naman po, mga 30 beds po ang in-increase nila. So kung makikita nyo po rito, ang mga alkalde po ng Kalakang, Maynila ay talaga nakakaisa sa nangyayari ngayon at mag-aambag po ng mga kama. On the other side po, gusto ko lang ibalita as spokesperson Harry na pagdating naman sa contact tracing, no, napaka-importante nito dahil isang taong umiikot, baka makahawa, ay gusto kong pasalamatan din ng national government kay Secretary Bello dahil siya ay nag-commit ng higit kumulang 230 million. No? This is about 14,000 contact tracers and this is good for 10 days. Ang ginawa na lang po namin sa mga mayors, imbis sa 10 araw, ay ginawa na lang po namin itong 3 buwan. No? So hinati-hati namin itong mga workers. In short, this 230 million will instead be given for 3 months.
Staying in the Philippines, according to DOH Undersecretary and Treatment Czar Leopoldo Vega, the government has already opened field modular hospitals to assist public and private hospitals in the ever-increasing number of COVID-19 patients in Metro Manila. Let's watch this.
Meron din kami nabuksan na facility dito sa QI. Ito yung Field Modular Hospital na naplano na ho namin last year pa kasi alam namin kailangan talaga infrastruktura ng moderate for moderate and severe. So itong field hospital na nagawa po ng DPWH last November, na-operate ho namin last week. So dahan-dahan na po sila nagbubukas. Ito ay 110 beds. So medyo may kalwa, may space na rin, lalong-lalo na for the moderate and severe. Doon naman sa isolation centers, so itong next Wednesday or Friday, bubuksan na ho namin yung 250 isolation center sa Maritime sa Subic. Ito ho ay makapagbigay ng isolation facility, lalong-lalo na sa positive COVID na may mild and asymptomatic na pwede namin i-transfer doon. Nabuksan din namin ang Eva Macapagal na nandito sa port area na 150 beds. At saka po ang yung sa National Government Activity or Administration Center sa New Clark City, ito may merong 170 residences na bubuksan din namin by next week. So ito yung ginawa namin habang 2 weeks para mabigyan ng sapat na number of isolation beds at saka COVID beds sa mga hospital para luluwang at hindi ma-strain yung ating health system capacity.
Sec Vega, yung mga karagdagang mga kama na binanggit nyo po, ano po ngayon ang current healthcare utilization rate natin para sa mga ICU beds at saka para sa mga COVID?
Kung bubuksan po natin yan, Secretary, lahat ng 142, ang ballpark figure namin sa HUR, mga bababaho na mga 75 to 77%. Hindi na high-risk position, at saka yung totality ng HCUR, baka nasa 58% na ano naman siya, na low-risk category na, hindi na moderate risk. So ito yung tinitingnan po namin sa pagbukas talaga ng number of isolation beds at saka treatment beds sa mga hospitals.
So ang nagiging strategy natin, Yusek Vega, imbis na magsara ng ekonomiya, talagang dinadagdagan na natin ang ating
Oo, kailangan talaga natin.
Cheaper to invest in healthcare facilities kaysa isarado po ang ekonomiya.
Tama yun, Secretary. We have to tame the virus, and we have to adapt to the present pandemic. Kailangan natin, the economy has to be there and we have to make sure na we can suppress and maximize our treatment response.
Meanwhile, DOH Undersecretary at Treatment Czar Dr. Leopoldo Vega also explained that within 2 weeks of ECQ implementation, hospital chiefs met and agreed with PhilHealth to implement a debit-credit payment mechanism to help hospitals increase their beds and improve also their health services. Take a look.
isa sa pinakamalaking basehan ng ating desisyon ng Pangulo at IATF na magdeklara ng MEC yung pinarami nating healthcare capacity, no? Nagdagdag po tayo, gaya ng sinabi ni Chairman Abalos, ng mga karagdagang hospital, hindi lang sa mga LGU hospitals, kundi sa publiko at pampribadong mga hospital. So can you give us an update po ano nang nadagdag na capacity, lalong-lalo na po yung ating mga ICU bed capacity. The floor is yours, Yusek Vega.
Alam niyo po, itong 2 weeks na binigay sa amin, itong break na ECQ, nagkaroon kami ng pagpulong-pulong sa mga chief of hospitals at saka yung mga implementors ng lalong-lalo na sa health capacity systems natin. Unang-una talaga napansin namin na ang pinakamalaking problema ng mga hospitals ay yung pagbayad ng PhilHealth. Kasi alam nyo, itong pandemya nito, kung wala ka namang sapat na financial resources, mahihirapan ka talaga mag-provide ng extra allocation for the number of beds. So sa tulong po ni Sec Vince, Sec Galvez, at saka utos po ni President Duterte, pumayag po yung PhilHealth through a mechanism, credit, debit, payment mechanism, na babayaran po yung hospital ng mga valid claims up to 60%. Ito ay very significant ho kasi itong financial resources na to, ito yung pwedeng magbigay ng more beds and allocation sa mga hospitals, lalong-lalo na sa pag-increase ng kanilang equipment at saka sa human resource sa private. So pagkatapos ho pumayag yung PhilHealth nito, kinausap na rin namin yung private and public hospitals at nagkaroon kami ng agreement na para hindi mahirapan ang ating healthcare response or hindi ma-strain talaga, kailangan magbukas sila ng kama at saka pumayag sila na sa both public and private, nakakuha kami ng mga 1,042 beds na allocated coming from public and private. Ito ay malaki po yan dahil ito ay maka-increase in the number of beds allocated for COVID. At saka sa ICU po, pumayag na rin sila na mag-increase in ICU setting. No? Hindi naman talaga yung setting ng ICU sa mga ward at saka sa private rooms at hindi talaga yung formal na ICU but kailangan mag-allocate sila ng mga beds in the wards and the private rooms na parang ICU ano naman din yung ang facility. So pumayag po sila nito at meron silang 142 na pwedeng may ICU beds.
Now, in other news, Australia has agreed to lend $1.5 billion to Indonesia to support an international COVID-19 response program. The loan, to be paid back over the next 15 years, will be used to support Indonesia's budget financing for 2020 and beyond. The development will be welcomed news to Bali locals, whose tourism numbers are currently at an all-time low. According to the West Australian, Indonesia's government predicts the loss of international tourism will leave a $14 billion hole in its projected 2020 income. The agreement between Australia and Indonesia recognizes the strategic partnership between the two countries while also supporting the Asian Development Bank-led COVID-19 response and expenditure support program.
Majority of the supplies of the coronavirus vaccine set to arrive in the second quarter will be coming from pharmaceutical firms in Russia and China. That, according to National Task Force Against COVID-19 Chief Implementer Secretary Carlito Galvez on Monday. As of April 10, he said 1,137,534 Filipinos have been vaccinated. Of the number, 851,876 are healthcare workers, 44,187 are senior citizens, while 110,457 are persons with existing comorbidities. To date, some 131,023 healthcare workers have completed 2 shots of the vaccine. Galvez said a total of 2.5 million doses of Sinovac's CoronaVac vaccine were already delivered in the country. These, he said, include the 1 million doses donated by the Chinese government and 1.5 million doses purchased by the national government. He said, quote, the majority of the newly arrived 500,000 doses will be sent to areas in the Visayas and Mindanao, since a substantial portion of the previous Sinovac doses have already been allocated in Metro Manila and neighboring provinces. The first batch of the Sinovac jabs was deployed to the Department of Health, 500,000 doses, Armed Forces of the Philippines, 70,000, and Department of National Defense, 30,000 doses as of April 11. Some 500,000 doses of CoronaVac and 523,400 doses of AstraZeneca vaccine were distributed across 17 regions nationwide. The DOH has also delivered 100% of the 525,600 doses of the AstraZeneca vaccine since March 17. Galvez, meanwhile, also said the country is slated to receive a total of 1 million doses of the CoronaVac vaccine on April 22 and 29. Another 2 million doses of government-procured CoronaVac vaccine will be delivered in May. Galvez likewise said the government is set to hold a vaccine simulation rollout for Russia's Sputnik V vaccine manufactured by the Gamaleya Research Institute. Some 20,000 doses of Sputnik V will be used in the vaccination dry run.
Now in Cambodia, the Ministry of Health issued a daily press release on the morning of 13th of April 2021, confirming the discovery of 181 new cases of COVID-19. 40 cases were treated and the patients discharged. Of the new cases, 178 were linked to what is still known as the February 20 community outbreak and 1 imported from abroad. This brings the total from the local outbreak to around 4,160, and the sources vary slightly. There were in Phnom Penh 140, Severine 14, Sihanoukville 8, Craveng 6, Kandal 3, Siem Reap 4, Takeo 1, Krati 1, and Previar 1. 3 imported cases were reported from the USA, India, and Cambodian migrant worker returning from Thailand. The total case number now stands at around 4,696 sources. It may vary, of which 2,406 are currently active. Authorities this week banned travel between provinces, imposed a nighttime curfew in the capital Phnom Penh, and shut down popular tourism sites, including the famed Angkor Wat Archaeological Park. Wearing masks or wearing face masks is now mandatory in Phnom Penh, and violators face a fine of up to $250. But Prime Minister Hun Sen on Saturday threatened harsher measures, saying anyone who flouts a 2-week quarantine period would face a quick trial and jail time. Cambodia has already passed a strict COVID-19 prevention bill that could see people who flout virus rules jailed for up to 20 years. Hun Sen also announced that being vaccinated was mandatory for all state officials and the armed forces, warning them they could be fired if they refuse.
The English variant of the novel coronavirus does not increase the severity of COVID-19 compared to other strains. That's according to research published today that also confirmed its increased transmissibility. The variant known as B117 is now the dominant viral strain across much of Europe, and previous studies had shown it was linked to a higher likelihood of death than normal variants. But 2 studies published in the Lancet Infectious Diseases and the Lancet Public Health journals found no evidence that people with B117 experience worse symptoms or a greater risk of developing long COVID than those infected with different variants. The research found, however, that the variant was associated with a higher viral load. and reproduction rate than normal variants. Commenting on the first study, Sean Wei Shang Ong, Barnaby Edward Young, and David Chin Lai from the National Center for Infectious Diseases in Singapore said that the findings were in contrast to 3 previous studies suggesting that B.1.1.7 was deadlier than other variants. However, they said the Lancet study had the benefit of having used whole genome sequencing as well as a good variety of patient and disease outcomes.
Now, in other news, French pharmaceuticals giant Sanofi, which was beaten by competitors to a COVID-19 vaccine, said on Monday it would spend 400 million euros on building a new plant that can produce several vaccines at once. The high-tech factory will be located in Singapore and will be operational in the first quarter of 2026. The company said, and adding that construction would start this summer. The new site will provide Sanofi with the ability to produce innovative vaccines on a massive scale for Asia and quickly respond to future pandemic risks, it added. Sanofi dealt a huge blow to France's pride in its pharmaceutical sector by being trounced in the race to develop a COVID-19 vaccine. The world's third biggest vaccine maker before the pandemic has said its vaccine candidate will not be ready before late 2021 at the earliest. In the interim, it has been reduced to helping produce vaccines for its rivals Pfizer and Johnson & Johnson. The Paris-based group said on Monday that whereas its other factories can only produce a single vaccine at a time, the Singapore facility would be able to produce 3 or 4. The factory will also be able to leverage multiple vaccine manufacturing technology platforms based on different cell types, which would allow it to roll out a specific vaccine faster depending on public health needs, it added. The announcement is the third of its type by Sanofi since the start of the coronavirus pandemic. It also plans new investments in France and Canada.
The COVID-19 pandemic is, quote, a long way from over. That, according to WHO Director General Tedros Adhanom Ghebreyesus, as 4.4 million cases were reported globally to WHO last week. The 4th highest number in a single week so far. There's more. Let's listen in.
In January and February, the world saw 6 consecutive weeks of declining cases. We have now seen 7 consecutive weeks of increasing cases and 4 weeks of increasing deaths. Last week was the 4th highest number of cases in a single week so far. Make no mistake, vaccines are a vital and powerful tool, but they are not the only tool. We say this day after day, week after week, and we will keep saying it. Physical distancing works, masks work, hand hygiene works, ventilation works, surveillance, testing, contact tracing, isolation, supportive quarantine, and compassionate care. They all work to stop infections and save lives. Right now, intensive care units in many countries are overflowing and people are dying. And it is totally avoidable. Some people appear to be taking the approach that if they are relatively young, it doesn't matter if they get COVID-19. This disease is not flu. Young, healthy people have died. And we still don't fully understand the long-term consequences of infection for those who survive.
When, in addition to scaling up immunity through vaccination, we reduce transmission, which also reduces the likelihood of having emergence of variants that could escape from vaccine-induced immunity. So this is just, again, a reinforcement that we have so much hope and desire to get on with more regular life as people become vaccinated. But it's actually the opposite. It's the very time when we should be as diligent as ever.
This pandemic is a long way from over, but we have many reasons for optimism. The decline in cases and deaths during the first 2 months of the year shows that this virus and its variants can be stopped.
Per week. Last week we had 4.4 million cases. If you look on our website and you actually look at the epi curve and the trajectory of the pandemic right now, it is growing exponentially. This is not the situation we want to be in 16 months into a pandemic where we have proven control measures. It is time right now where everyone has to take stock and have a reality check about what we need to be doing. There was a 9% increase in transmission last week, 7th consecutive week where we've seen an increase in transmission and a 5% increase in deaths. This is not the direction we need to be going, and we really need to be serious about this. It is vaccines, but it's not vaccines only, it's vaccines and. What can you be doing every day? What can we be doing to keep yourself safe and your loved ones safe?
More updates around Asean region after a short break.
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights. Sharpen your instincts for smart decision-making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
Welcome back to the program. And the country's inflation rate remains under control despite surpassing the government's target band since January this year, according to Governor Benjamin Jokno said. Domestic inflation rate was on the rise since the last quarter of 2020 and exceeded the government's 2 to 4% target band since January this year, when it rose to 4.2%. He said this lower inflation rate last March was due to several factors like deceleration of the rise in vegetable inflation as well as meat inflation, with the latter on the price ceiling imposed on this product to address the impact of supply constraints. Let's watch this.
Well, that's actually good news, yung pagbaba ng inflation from 4.7 February to 4.5% nitong March, no? Ang pagbaba ng inflation rate ay masasabi natin na dulot ng mas mabagal na pagtaas ng presyo sa mga piling food items like vegetables and rice, for example. Kaugnay nito, bumagal din ang meat inflation. And yun naman dahil sa pinataw na price ceiling noong Marso. Sa kabilang banda, tumaas naman yung transport inflation dahil sa pagtaas ng presyo ng domestic petroleum products at sa pagtaas ng inflation sa transport services. So, ang tingin namin ay patuloy na bababa. Siguro tataas pa ng medyo mataas pa rin ng inflation for the first 2 quarters this year, pero bababa rin siya sa second half of the year, so that ang initial forecast namin for this year, our inflation rate will average around 4.2%.
Citing the Department of Labor and Employment data, Mr. Jokno said there are about 5.1 million workers who were retrenched and lost their jobs because of the closure of some establishments. However, he cited the improvement of investors' sentiments based on the latest business expectation survey of the BSP, which the respondents point to possible impact of the coronavirus disease 2019 vaccination rollout, reopening of the economy, and growth in sales orders.
Staying in the Philippines, Bangko Sentral ng Pilipinas Governor Benjamin Diokno said that increasing confidence of business owners only means that entrepreneurs are now more willing to hire, and jobs in various sectors such as healthcare, construction, telecommunications, and as well as in government is in high demand. Take a look.
Well, ang pagbuti ng business sentiment ay nagpapakita na maraming businessmen at saka mga industriya ay maaring mag-hire ng mga manggagawa sa mga susunod na buwan. Ang mga in-demand na trabaho ay nasa healthcare, construction, BPO at saka sa gobyerno. Magkakaroon din ng mga job opportunities sa telecommunications, logistics, and IT BPO business. For example, customer service representatives, technical support staff, frontline specialists, human resources and recruitment staff, finance, information technology, and marketing.
In other news, markets mostly rose in Asia on Tuesday as investors gear up for much anticipated earnings season and the release of key inflation data later in the day. After a recent run-up in equities that saw the SP 500 and Dow end last week at record highs, traders are taking a breather as they await the next buying catalyst. A forecast-busting reading on U.S. producer price inflation last week gave markets a taste of what to expect over the next few months as the global economy emerges from last year's crisis and vaccinations allow people to slowly return to their pre-pandemic habits. The release of consumer price data is being closely followed. There are growing fears that reopening will send prices surging this year and force central banks to tighten the ultra-loose monetary policies, including rock-bottom interest rates that have helped fire a year-long equity rally. The Federal Reserve has repeatedly pledged not to change tack until inflation is elevated for some time and unemployment is under control. Markets in Asia enjoyed gains with Hong Kong, Tokyo, Seoul, and Wellington all more than 1% higher. Shanghai, Sydney, Singapore, and Taipei also rose, though Manila and Jakarta slipped.
And finally, in our news, the blockchain entrepreneur who paid a record $69.3 million for a digital artwork looks, at first glance, nothing like a wealthy collector. Take a look. This 32-year-old is casually dressed in a t-shirt and chinos, lives in a regular Singapore apartment, and doesn't own any property or a car, with most of his investments in the virtual world. He said, "My prized possession would be my computer and maybe my watch." This according to Indian-born Vignesh Sundaresan, also known by his pseudonym Meta Kovan, and he told this to AFP from his sparsely decorated flat. Last month, the programmer bought the world's most expensive NFT, U.S. artist Beeple's Everydays, the first 5,000 days, highlighting how virtual work is establishing itself as a new creative genre. Sundaresan defended the price he paid for the collage of 5,000 pieces of art created on consecutive days, which has transformed its creator, real name Mike Winkleman, into the third most valuable living artist. I thought, he said, this was that important. He also said, as a piece itself, it's awesome, but there is the signaling and symbolic intention also to show the world that, quote, there's this whole thing that's going on underground, unquote. With NFTs, many see an opportunity to monetize digital art of all kinds, offering collectors the bragging rights to ultimate ownership, even if the work can be endlessly copied. The popularity of NFTs has been slowly growing, but only really hit the headlines when the sale of Beeple's latest work. As an undergraduate engineering student, Sundaresan said he couldn't even afford a laptop before. He tried to build various web services which failed, but he got his break by founding a cryptocurrency company in 2013. And now he is chief executive of an IT consulting firm, as well as financing the NFT investing fund Metapurse. Thank you for keeping me company, Faye.
Yes, you are always welcome, Alma. And those are the latest updates around Asean region, and we will continue to give those updates. This is Faye Barte from your EBC Thailand Bureau, and we live in interesting times.
We'll see you back tomorrow. I'm Alma Angeles, and we live in interesting times.